as many of you know, the PPACA, as we call it for short, the Federal Health Care Bill, was passed, and if you have been in my office, you have seen the actual bill printed off in a binder next to my desk, and it is every bit of 2,000 pages and a good 3.5 to 4 inches thick. But for the purposes of today's discussion, I'd like to just talk about the 11 pages that we are charged with, and House Bill 609 deals with those 11 pages specifically in terms of creating a state health insurance exchange. Now, before we get started on a brief summary, I remember as a little boy, my parents, of course, grew up on beef cattle farms, and the Kansas City stockyards was certainly a place they went as children. And I do remember being in the stockyards as a little boy during the American Royal. And for those of you that have been on Genesee Street, you have seen the Kansas City Stockyard building. And on the side of that building it says the Kansas City Livestock Exchange, a place where men came to buy and sell cattle. If you've been to a farmer's market, you have been to a produce exchange. For those of you that travel and have utilized Expedia or Travelocity, you utilized an exchange. For those of you that have purchased insurance through a website like Progressive or esurance.com, you participated in an insurance exchange. And so the notion of an exchange is not particularly new. In fact, Newt Gingrich wrote extensively about healthcare transformation in his book, Real Change. The good news in Newt Gingrich's book, in comparison to my bill, is that my bill doesn't force folks to buy insurance or provide penalty provisions if they don't comply. This is a pure exchange allowing market forces to assist Missourians in obtaining information about coverage, cost about coverage, and allowing them to make an educated choice, the kind of plans that they would like to have for their small business or for their individual policy. My bill 609 is not new to the legislature either. So not only is the idea of an exchange not new, the idea of the state of Missouri establishing an exchange is not new either. In 2007, Senate Bill 556 was introduced by Senators Loudon, Gibbons, Shields, Nodler, Ridgway, and Crowell, doing in large part what House Bill 609 does, which is establishing an exchange, allowing people of this state to shop for and compare insurance policies. You'll notice the very first part of House Bill 609, where we are naming the exchange the Show Me Health Insurance Exchange. Show Me Health Insurance Exchange. The title in and of itself seeks to comply with the spirit of the 11 pages of the Federal Act in allowing Missourians the opportunity to shop and compare insurance coverages. Let me run through just a brief summary of this bill, and then I'll be happy to take questions from the committee. We are establishing a quasi-governmental agency with a board of directors. In some sense, thinking back to when Missouri Employers Mutual was spun off as the high-risk pool and actually became an independent insurance company, now participating in the work comp marketplace. We do require the exchange to facilitate the purchase and sale of qualified health benefits. We also, in the exchange, implement a procedure to certify, recertify, or decertify a health benefit plan consistent with the state and federal guidelines. We do provide an enrollment period for these plans, as well as a special enrollment period as written in the Federal Act. We will maintain a website, and this is one of the things that you should keep in mind. A website will simply be a portal for information, comparing plans and prices for the consumer. A lot of folks don't have broadband or are comfortable using the internet. So like Expedia or Travelocity or Progressive.com, we will also, in the bill, enable the board of directors to establish a toll-free number. So no Missourian can say, I don't have access to broadband, I can't participate. We will, through the exchange, operate a toll-free number so folks can call and get information. And in addition, we will establish a broker referral network so folks can, if they are uncomfortable buying over the phone and would wish to speak to somebody directly, they would be able to locate health insurance producers in their community who are willing to sell insurance in the exchange. So it is a three-tiered marketing tool that the exchange will operate to educate consumers. We have unified the exchange in that individual and group.
Representative Sager.
Inquire, Mr. Chairman.
Please proceed.
I noticed your fiscal note on this is 0.
Yes.
Is there going to be any employees, state employees, to talk to people when they call?
Well, I anticipate that the exchange will probably do two things. First, there's going to be some employees to run the day-to-day operation. I'm envisioning maybe there's 10 or 12. I mean, I think it's hard to put a number on it right now. But the funding mechanism, and thank you for mentioning no fiscal note, the funding mechanism is the PM per member per month, kind of the same way we assess fees for the high-risk pool that exists today. So carriers participate in that assessment. So that'll be one stream of revenue. The second will be probably an RFP that we would procure for the management of a website, or the folks on the 800 number would be part of the process. The other source of revenue for these operations, of course, would be complying with federal requirements for an early planning grant. Kansas recently received one, an innovator grant is what they called it. There are some deadlines laid out, and I'm sure folks from the Department of Insurance could testify more elaborately, but there is a process in place where when our exchange is approved, we can submit it to HHS for approval, and that would allow us to pull down some additional grant money for implementing the exchange. We have already received a $1 million grant through the Department of Insurance that they have ready to begin implementing this as soon as possible.
You said per member per month.
Mm-hmm.
Is that per member insurance company, or are we talking about individual,
per health carrier.
Individual policyholders?
Each health carrier that would be granted a certificate of authority in the state would pay an assessment into the exchange as a per member per month fee, the way we do with the high risk pool right now. Very similar.
Okay, I'm just trying to figure out where the funding was coming from, because I knew.
No general revenue, sir.
Nothing free. Thank you.
Mm-hmm. I'll go ahead and cut my comments short then. If there are any other questions, you do have a summary on your desk. I will conclude by saying this bill does have a severability clause. Obviously, if the federal health care bill is ruled on by the Supreme Court, if the bill is indeed thrown out, there's a severability clause in this bill to address that. But if this committee or others that come after us decide that an exchange is indeed a good idea, they could take this as a framework to go ahead and establish an exchange here in the state of Missouri anyway.
Representative Lichtenegger.
To inquire,
Proceed.
if we would decide to keep the exchange anyhow, would that open the door for places that only have, two companies to choose from for small businesses? Would that then open that door up to them for more places to choose from?
Well, I mean, I'm of the opinion that it would. Now, the exchange as written certainly would allow any business that has a desire to get a certificate of authority to enter the exchange. You don't have to think of this traditionally as Humana or Aetna or Coventry. This could be an opportunity for a lot of folks to enter the health insurance market. Many of the companies that we do business with here in the room personally or with our businesses don't sell health insurance. State Farm does not sell State Farm health insurance. Farmers Insurance Group, Geico, Progressive, these companies do not sell health insurance. hopefully this is a paradigm that would encourage other insurance carriers or other companies in unrelated industries to seek a certificate of authority and to give our small business owners, and you and I have talked about your situation with your business at home, more choices than they currently have.